Hi, my name is Jessica Breton, and I am the Executive Director here at OPI in Los Angeles. Today, we're going to talk a little bit about high functioning autism and how residential treatment programs can assist young adults who may either already have that diagnosis or are thinking that they may. In terms of what high functioning autism is it's a neurodevelopmental condition that we often see on the spectrum, meaning everyone presents slightly different from one another. Some young adults may show a lot of the symptoms of autism spectrum disorder, and some may be much more subtle and difficult to even identify. What we often see with this condition is a struggle or difficulty when it comes to social skills. That could be reading social cues, engaging in effective and appropriate social and interpersonal conversations. It can be how to make friends and maintain lasting and deep friendships over time. We also see a struggle when it comes to executive functioning skills. And this is really important when we talk about young adults because there are a lot of executive functioning skills that are required in independent living skills. And so these young adults often struggle with things like maintaining a proper budget, personal hygiene skills, planning around school and coursework, or applying for jobs. And so it really starts to show up a little bit more when the demands of life increase as a young adult. And so it can often get missed as a child, right? And when these demands increase, we start to see more of it show up. And with some young adults with autism spectrum disorder, we do see some sensory sensitivity as well. And this could be to loud noises, certain touch, certain visual sensations as well. And so these are all things that we want to be mindful of as well when we're working with young adults. We can see a lot of daily challenges in a young adult with autism spectrum disorder. And so, again, social interactions can become difficult and complicated. Executive functioning skills can become a challenge. Young adults may excel actually academically, they can be very highly intelligent. And so, again, in a school setting, things may be going really well. And then outside of school, they may be struggling. And sometimes it's hard to tell and know that they are struggling with loneliness, isolation, maintaining day-to-day tasks that they're expected to do, and they start to realize that they may be a little bit different from other people. And that can be something that is difficult for them as well and really requires some additional external support. With autism spectrum disorder, we can see a lot of emotion regulation difficulties. So this can come from a place of frustration. This can come from a place of not being able to read what's happening. There are lots of reasons that would lead to emotion regulation. And what that looks like is it can look like in a younger child, it could look like meltdowns and tantrum. In a older young adult, it could look like adult tantrums and meltdowns. It can look like substance use. It can look like staying in bed all day and not able to get up and face the day and tolerate what's in front of them. So it can show up really differently for everyone. It's really important for caregivers to be able to identify what's really at the root of the behaviors. Oftentimes, these young adults get misunderstood as being defiant or resistant or just having behavior problems. And that's really not what's going on for these young adults. It's so much more than that. And they are seeking support and they are needing additional care and support that's really attuned to the different neurodevelopmental situations that are going on for them. There are a lot of co-occurring conditions that we see with autism spectrum disorder. So depression and anxiety are probably the two most common ones. There's a lot of loneliness and isolation that can feed and fuel depression, a lot of internalized negative core beliefs about themselves. Why am I different? Why do I struggle in these ways and my peers don't seem to? And all of that really feeds and fuels depression. Anxiety is incredibly common with ASD, and that can be social anxiety, but it can also be generalized anxiety. It can be specific phobias. It can be OCD. These are very, very common to see alongside ASD. ADHD is another common one. ADHD is interesting because it's a co-occurring disorder and it's a very common differential disorder. There's a lot of overlapping symptoms between ADHD and ASD, and it can be tricky for caregivers or professionals to really know what exactly is going on and which direction to go in. And so that's a really important one that you want to get some additional maybe assessments or testing done to be able to distinguish between the two of those. We see general emotional regulation disorders happen alongside ASD. It's not uncommon to see either substance use disorders or even a specific eating disorder called ARFID is quite common when it comes to um, ASD. And back in the day, they used to call that picky eating, and think that it was really just related to maybe sensory or texture, but it's really bigger than that and quite common to see. Residential treatment can really be a great option for young adults struggling with autism spectrum disorder for many reasons. I think independence is most people's goals, right? And to be able to have support in learning how to live independently and function independently in spite of what some of those struggles may be. Family relationships can get strained when we're living at home with a young adult with autism spectrum disorder. Parents don't get to just end parenting when their kid turns 18, right? There's a lot more responsibility on that parent, and it usually falls to one parent over the other to take on the majority of that caretaking. And so we really want to be able to shift some of those roles and rules and relationships in a family system to get a better balance and to improve those family relationships. And sometimes having that young adult go to residential treatment can really allow space to heal some of those family relationships and recreate healthier boundaries within that family system. The other thing that happens when you are in a place where you are receiving support 24/7 is all the in between moments that you don't get to focus on in an outpatient therapeutic setting. All the magic that happens in between a therapy session, all the nuances and real life situations that pop up in between a therapy session, you can address in real time in that moment, which is really, really magical. The social stuff, the interpersonal stuff that happens when you are going on an outing in the community and you have to order food at a restaurant or interact with someone that comes over and talks to you. Roommates, roommate dynamics. What better way to really approach and address social skills and interpersonal dynamics through a roommate situation, which is difficult and can be a struggle for any young adult navigating that, and even more of a struggle for someone who already, has a social deficit. Independent living skills. When you get out of that house, you got to be able to brush your teeth every morning. You have to be able to budget an allowance. You have to cook some meals for yourself. Things that normally happen maybe at home with a parent or a caregiver, we really want a young adult to be able to master these skills and feel a sense of confidence that they are capable of doing these things. And sometimes just need to be pushed in a different way and supported in a different way. Social isolation is real when it comes to ASD. And so to be surrounded by a community of peers who are all navigating similar things in their life and who are all needing support for different reasons creates a sense of community. And truthfully, community and connection is one of the most important and powerful aspects of life for a young adult who is struggling with this level of social isolation and anxiety. It can be really scary as a caregiver or family member to consider sending your child to a treatment program. At the same time, there's research that shows only about 1 in 5 young adults on the spectrum live independently in their early 20s, which means the vast majority of them remain at home. And I don't think that that's necessarily the best option for the young adult or for you as the caregiver. You deserve to be able to focus on you and your life and your relationships and your hobbies and your career. And everyone's relationships become healthier when there is independence and healthy independence or interdependence. Young adults, if we think about what is expected, normal, typical from a biopsychosocial developmental stage, as a young adult, it's intimacy versus isolation. They are hardwired to crave intimacy and connection, and they deserve an ability and an opportunity to find that for themselves. And sometimes they just need some additional skills and support to be able to achieve that. So giving them an opportunity to be involved in a community of peers, like-minded peers, and staff that can support them through this is a gift that you can give them. Additionally, a residential treatment program can provide structure and boundaries and support all at the same time, and offer some multidisciplinary therapies to really target the variety of different ways autism can show up for a young adult. So, DBT is one that we use primarily here at OPI, Dialectical Behavior Therapy. And the 4 modules of DBT are interpersonal effectiveness, distress tolerance, emotion regulation, and mindfulness. And while DBT originally was created to address borderline personality disorder, and why OPI actually started incorporating DBT into our program, we have found over the years that it is absolutely instrumental and effective for working with young adults with autism spectrum disorder. And when you think about those modules, they really target a lot of those symptoms that we are seeing with young adults who have ASD. So emotion regulation is fairly common with young adults with ASD, and to really help provide them with skills to target how do we regulate our emotions when our anxiety is at a 9 or a 10, what are those skills we can apply in those moments to regulate? Distress tolerance, right? How can we use the tip skill, right? And put our face in a bucket of ice to kind of get ourselves back to baseline so that we can then practice those social skills and have appropriate interpersonal interactions. Interpersonal effectiveness. How can we master using a dear man to get our needs and wants met instead of some old maladaptive ways that aren't working for us? And so if we can use all these skills, we start to see less social isolation, more improved and healthier interpersonal relationships for these young adults, which then directly impacts how they're feeling day to day. The depression starts to lift, the anxiety starts to decrease a little bit. And we're really seeing that in the clinical outcomes that we're measuring over time. We're seeing depression levels on a PHQ-9 decrease. We are seeing the anxiety levels on a GAD improve. We are seeing the OQ45 scores improve, right? And so really being able to flood these young adults with some skills that they've never had before is quite instrumental. In addition to the DBT, we're also really focusing on life skills. Every young adult that comes to OPI has an individual life skills specialist who acts sort of like an accountability partner and really focuses on some SMART goals, some short and long-term goals. How are we going to plan for these goals? How are we going to execute these goals collaboratively and together? And really, most often they're focused on some executive functioning goals or independent living skills goals. And that could be around health and nutrition, budgeting and finances, routines of healthy living. One of the most common ones we see are AM and PM routines. What kind of routine can we set up for ourselves every morning so that we can get up, get out of bed, and be prepared to face whatever that day has for us? In the evenings, how do we wind down, right? How do we have some routine so that we have healthy bedtime hygiene? We're really taking care of ourselves and engaging in some self-care and preparing ourselves for the next day. Our life skills specialists also can really have quite an impact when it comes to social skills and socialization. So they may pair up with another life skills specialist and client and go out to lunch together and have an in vivo, in real life opportunity to practice some of this and have these conversations and then be able to redirect in the moment. If there's a young adult who's maybe talking about the same topic over and over again for half of the lunch, and the other young adult is seeming to be a bit disinterested or bored, that life skill specialist can really step in that moment and help shape how the rest of that conversation is going to go and provide some modeling, which is another wonderful benefit of being in a community in a treatment program, is that social modeling and positive peer pressure. There's nothing better than watching your peers around you engage in a certain way and being able to model and mimic that. Or a positive peer pressure if you have a roommate who's getting up every day and brushing their teeth or taking a shower or doing their laundry. You're probably going to want to do the same or be more motivated to do the same. Education and careers are part of an independent, young adult independent life. And so we want to provide support in those areas as well. Oftentimes, those executive functioning and interpersonal social struggles can really impede one's ability to be successful in an academic setting or a career setting. So it's really important to provide support around those things. How do we plan for a semester? How do we take a syllabus and break it down into small steps? How do we make sure you have the right accommodations in a high school or college setting to account for what you may need? Do you need someone to take you to the campus and walk around to find your classes before that first day so you're not having to navigate that on your own on day one? All the different ways that one would need support to be successful in an educational setting. Same thing with a job setting. There's a lot of interpersonal skills required when you are applying for a job, interviewing for a job, engaged in a job with coworkers and supervisors and customers. And so really navigating those processes and practicing, doing mock interviewing, having someone take you to ask for applications and how to do that in an appropriate way, practicing and role-playing scenarios of what may happen with a customer or a supervisor or a coworker, really tying in those DBT interpersonal effectiveness skills and distress tolerance skills when you have a boss that you can't tolerate or increases your anxiety. And really practicing this stuff in a real world environment and setting so that these are skills and tools that one can take with them moving forward for the rest of their lives. We sometimes have young adults start with a volunteer opportunity, a lower stake, lower pressure situation, but a beautiful, beautiful opportunity to practice social skills, interpersonal skills, all the raw skills it takes to apply, have references, even say thank you after an interview, and remember to do those small details that one needs. In terms of what families should look for when choosing a residential treatment program, I think it's really important to make sure that a treatment program is doing a thorough assessment on the front end. You want to make sure that they have all of the information that they need to confirm that they're going to be the right fit for your family and for your loved one. Are they asking you as caregivers questions? Are they asking to speak to prior treatment programs or providers or therapists or medication prescribers? Are they wanting to speak directly to the young adult, which is incredibly important? We want to get their own experience in their own words from their perspective so that we can ensure that we can tailor our treatment to fit and meet those needs. We want to make sure that there is a flexible treatment planning process while also having a set structure around it. So structure is going to be really important, and everyone is going to be different and nuanced. So are there flexibility with how a behavioral system is implemented? So one young adult may be able to wait a week for an incentive as part of a behavioral system, while a young adult with autism may not be able to wait that whole week. They need a more immediate reinforcement schedule? Is a program going to be willing to make those accommodations and be flexible in that way? Is there a community integration life skills component? We can do all the treatment we want for things like depression and anxiety and ADHD, and if there's not an opportunity to get out into the community and practice applying those skills and have a coach coaching you on those skills, then you leave treatment really unprepared and without a cemented, solid foundation of how to continue that work outside of treatment. And so we really want to make sure there's a scaffolded approach. Maybe start out with more structure, more support, a little bit more hand-holding, and as they progress through the program, they're given opportunities to demonstrate an ability to do these things on their own more independently, so that by the time that discharge date comes, that young adult is feeling really confident in their ability to continue on with these things, and you as a family member or a caregiver can also feel really confident and independent that they're going to be able to do these things. We really want collaborative process when it comes to discharge planning. What's going to happen after this program? Do we want them to come back and live at home? Do we think they need to be able to live independently? And if so, what supports need to be provided and set up for them in that situation? We've seen young adults who are able to go back to college with some life coaching support and therapeutic support. We've seen young adults who will get their own apartment and even with a roommate for some socialization and community, and maybe have a life skills specialist check in a couple times a week and make sure that laundry is getting done and the stove's being turned off and the bills are being paid and all those things that those young adults need to be able to accomplish. You want to look at what the staffing ratio is going to be. Is there going to be enough support from a staffing standpoint for my young adult? Right? If there's a 1 to 10 staffing ratio, that's going to look really different than a 1 to 5 staffing ratio. And then you also want to ask questions about the other young adults. And there's pros and cons and benefits to being in a program with only young adults with ASD versus being in a program where there's a wide variety of clients with a wide variety of issues who can learn a lot from one another, practice patience, compassion, and tolerance, have some social modeling, being able to look at someone who maybe doesn't struggle socially and is quite adept socially and have that person guide you and mentor you from a peer perspective can be incredibly powerful, sometimes more effective than a staff doing that. Some of the typical concerns or questions that families have about sending their young adult to treatment really generally is around the level of support that they're going to have. They know what they've had to do for their young adult at home for so long and really question and wonder if that can be replicated in a treatment program setting. And so really reassuring a family what that level of support is and what that looks like, while also reminding them that we don't want to replicate what was happening at home. We want to do something different to create some change. I think for family members, parents, oftentimes mothers who have devoted so much of their life to helping their child thrive in the world, it can be a difficult process to let go and take a step back and trust people or a program to be able to fill that role for their young adult. And so I think really creating that trusting relationship, asking whatever questions a family member needs to ask, having access to the treatment team whenever they need to make sure that they have a comfort level around what's happening. The other common concern I hear is the social aspect of things. Well, what if people are mean to them? Are they going to be bullied? Are they going to be isolated? Well, what if they isolate? How is it going to be different than it is at home? How are you going to get them out of bed to their appointments when we couldn't? Part of that is that really sort of standard traditional saying of like, we're not mom and dad. It's different when it's mom and dad, right? And that does actually happen sometimes where they get out and away from mom and dad and it's just not as much of a struggle. And sometimes it is. And we have a lot of different ways that we can approach that. But oftentimes it goes back to asking that young adult, what do they want? What are their goals? It's not about mom and dad's goals. It's not about the therapist's goals. It's not about the treatment team's goals. What are their goals and what do they want for themselves? 9 out of 10 times, The answer is something around interpersonal connection. They want friends, or they want to feel connection in some way. And so everything is based off of those goals. Well, if you don't get up in the morning and you don't get to that first appointment, how are you going to achieve that? How is that helping you get closer to those goals that you have for yourself? If you don't shower or do your laundry and brush your teeth, how is that going to serve you towards this goal of interpersonal connection? Or is it going to deter you from being able to connect with other people? So really reinforcing that there are skills that we can apply, and really staying goal oriented can be quite effective working with these young adults. We've seen some pretty amazing success stories with our young adults who have high functioning autism. And some of the ones that stand out to me are, as in my mind, as simple as a young man who came and really struggled with basic self-care and independent living skills. And so when he heard that he had to make meals for himself, he really relied initially on frozen microwavable meals and an occasional peanut butter and jelly sandwich. And I remember his last session with me at the time. He walked into my office with a little mini chicken pot pie that he made from scratch. And I was blown away, would never have thought that this was someone that would go from relying on frozen microwavable meals to cooking a chicken pot pie for himself and one for me. And he was telling me about the night before he made pasta with grilled chicken, and just these things that you really don't know if these young adults are going to be capable of when they first come. And it's incredible to see the journey and the process and the progress that they go through. This same young man he had long hair, a ponytail, and it was always pretty unkempt and ratted, and there were certainly some hygiene issues initially. And that session, he walked in with the chicken pot pie. He had the most gorgeous combed clean hair flowing outside of a ponytail, and it was just such a new version of who he was. And the smile on his face and the confidence that he walked into that office with, I mean, was just amazing to see. His parents still keep in touch with me and send me some update emails. And he completed college, graduated college, applied for graduate school, and has a small group of friends. He calls them his D&D friends. They do a lot of the Dungeons and Dragons together, but he actually started a club at his college around D&D, and that's really where he met his small group of friends, and he is thriving and doing so well. So there's so much hope. There's so much possibility. It's about mastering skills, building confidence, and maintaining hope.